Tuberculosis: the best treatment options. Tuberculosis, TB, is a potentially serious infectious disease that mainly affects your lungs. The bacteria that cause tuberculosis are spread from one person to another through tiny droplets released into the air via coughs and sneezes. Once rare in developed countries, tuberculosis infections began increasing in 1985, partly because of the emergence of HIV, the virus that causes AIDS. HIV weakens a person's immune system so it can't fight the TB germs. Because of stronger control programs, tuberculosis began to decrease again in 1993, but remains a concern. Many strains of tuberculosis resist the drugs most used to treat the disease. People with active tuberculosis must take several types of medications for many months to eradicate the infection and prevent development of antibiotic resistance. Symptoms. Although your body may harbor the bacteria that cause tuberculosis, your immune system usually can prevent you from becoming sick. For this reason, doctors make a distinction between latent TB. In this condition, you have a TB infection, but the bacteria remain in your body in an inactive state and cause no symptoms. Latent TB, also called inactive TB or TB infection, isn't contagious. It can turn into active TB, so treatment is important for the person with latent TB and to help control the spread of TB. Active TB. This condition makes you sick and can spread to others. It can occur in the first few weeks after infection with the TB bacteria, or it might occur years later. Signs and symptoms of active TB include coughing that lasts 3 or more weeks, coughing up blood, chest pain, or pain with breathing or coughing, unintentional weight loss, fatigue, fever, night sweats, chills, loss of appetite. Tuberculosis can also affect other parts of your body, including your kidneys, spine or brain. When TB occurs outside your lungs, signs and symptoms vary according to the organs involved. For example, tuberculosis of the spine may give you back pain, and tuberculosis in your kidneys might cause blood in your urine. Causes. Tuberculosis is caused by bacteria that spread from person to person through microscopic droplets released into the air. This can happen when someone with the untreated, active form of tuberculosis coughs, speaks, sneezes, spits, laughs or sings. Although tuberculosis is contagious, it's not easy to catch. You're much more likely to get tuberculosis from someone you live with or work with than from a stranger. Most people with active TB who've had appropriate drug treatment for at least 2 weeks are no longer contagious. Weakened immune system. A healthy immune system often successfully fights TB bacteria, but your body can't mount an effective defense if your resistance is low. A number of diseases and medications can weaken your immune system, including HIV/AIDS, diabetes, severe kidney disease, certain cancers, cancer treatment, such as chemotherapy, drugs to prevent rejection of transplanted organs, some drugs used to treat rheumatoid arthritis, Crohn's disease and psoriasis, malnutrition, very young or advanced age, diagnosis and treatment. The most commonly used diagnostic tool for tuberculosis is a simple skin test, though blood tests are becoming more commonplace. A small amount of a substance called PPD tuberculin is injected just below the skin of your inside forearm. You should feel only a slight needle prick. Blood tests. Blood tests may be used to confirm or rule out latent or active tuberculosis. These tests use sophisticated technology to measure your immune system's reaction to TB bacteria. Quantiferon TB Golden Tube Test and T-Spot TB Test are 2 examples of TB blood tests. Imaging tests. If you've had a positive skin test, your doctor is likely to order a chest X-ray or a CT scan. This may show white spots in your lungs where your immune system has walled off TB bacteria, or it may reveal changes in your lungs caused by active tuberculosis. CT scans provide more detailed images than do X-rays. Sputum tests. If your chest X-ray shows signs of tuberculosis, your doctor may take samples of your sputum, the mucus that comes up when you cough. The samples are tested for TB bacteria. Sputum samples can also be used to test for drug-resistant strains of TB. This helps your doctor choose the medications that are most likely to work. These tests can take 4 to 8 weeks to be completed. Medications are the cornerstone of tuberculosis treatment. But treating TB takes much longer than treating other types of bacterial infections. Home remedies. Black pepper. Black pepper helps cleanse the lungs, which in turn helps alleviate chest pains associated with tuberculosis. Also, due to its anti-inflammatory properties, it can reduce the inflammation caused by the bacteria and constant coughing. Mint. Mint is very advantageous for treating tuberculosis due to its healing and antibacterial properties. This remedy will help dissolve mucus, revitalize body organs, and nourish the lungs, as well as helping to prevent dangerous side effects of medicines taken for tuberculosis.